All right. So safety in healthcare, something that I think we can all agree is pretty important.
Absolutely. Yeah.
And we've got this article here, Stop 5 Safety, and it's all about giving like practical steps to nurse leaders on building this whole safety first culture. But we're going to go like deeper. We're going to look at why safety is actually the foundation of, a truly excellent healthcare experience
Hmm.
for everybody, like for the patients and for like all the amazing people who take care of us.
One of the things that really struck me about this article is how it talks about safety.
Yeah.
It's like not just another thing on the to-do list. It's like foundational. You know what I mean?
Yeah. Yeah.
Like excellent nursing care, top-notch patient care, even just like a healthy environment for healthcare workers. Like all of that rests on this idea of safety.
Yeah, and they have this catchy phrase in the article, sounds like PS,
Uh-huh.
which basically means problems and solutions.
Right.
And they're like spot on because when safety gets pushed to the side, we all feel it. Like whether you're the patient or the person giving the care.
Yeah, totally. And the article ties this idea of safety to this thing called the excellence framework. And it basically says that, like, when you prioritize safety, everyone wins. Patients feel more confident about their care, nurses and staff feel empowered to do their best work, and the whole system just runs smoother.
Okay, so we've got that safety is like the foundation, right?
Yeah.
But what about when like that foundation starts to get a little shaky? This article does not sugarcoat what can go wrong when the demands of, just everyday stuff in a hospital overshadow safety.
Yeah, think about it. Nurses and doctors, they're constantly juggling these like super complicated tasks, often under like tons of pressure, not enough resources. And in that kind of environment, mistakes happen, even with the most dedicated people. And this article gives some like pretty serious examples, like overworked staff leading to medication errors, not having enough staff increasing the risk of like patient falls, and even like lapses in infection control, which, puts everybody at risk.
And it's not just like the patients who are vulnerable in these situations, right? This article also talks about the risks that like healthcare workers face every day. And we're not just talking about physical risks.
Yeah, I mean, we often focus on those physical risks,
Yeah.
like lifting injuries, accidental needle sticks, and those are definitely serious. But the emotional toll of working in a high-stress, high-stakes environment like that, it's huge. Burnout is like rampant in healthcare, and it's a direct result of this constant pressure to like deliver exceptional care, but in a system that often feels like it's at its breaking point.
Yeah, it's like this like vicious cycle. Stressed, overworked staff, they're more likely to make mistakes, and then that compromises safety even more, which adds to the pressure, and then boom, more burnout.
Exactly. And that cycle, it impacts all of us. Like it puts patient outcomes at risk, it leads to higher turnover rates for healthcare professionals, and ultimately, it just erodes trust in the healthcare system as a whole.
Okay, so how do we like break this cycle? The article suggests that it's not about pointing fingers, but it's more about building a culture where safety is everybody's responsibility.
Exactly. And they talk about this idea of a pathway to excellence, and it's all about highlighting that safety is a team effort. It's not just on the individual nurses or the
Right,
leaders.
right.
It's about creating systems and structures that like support safety at every single level.
I like that. So what does that actually look like? In the real world, the article gives 5 like concrete steps that nurse leaders can take to build this culture where safety comes first. And I think these steps apply like everywhere in healthcare, not just for nursing.
Yeah, for sure. So step one is all about fostering open communication. So imagine a hospital where nurses and other staff, they feel comfortable like speaking up about safety concerns or like
Mhm.
near misses or potential hazards without being afraid of getting in trouble. Like that's what we're aiming for.
So it's like creating a space where people feel safe to like raise their hand and be like, "Hey, I think there might be a problem here."
Yeah, exactly. The article suggests things like having anonymous reporting systems, having regular like safety huddles where staff can openly talk about any issues they've encountered,
Yeah.
and just creating a general atmosphere of like transparency and non-punitive feedback.
Yeah, because if you create a culture of like fear and silence, people are going to like just hide problems. And then that makes everyone less safe in the end.
Exactly. When you have open communication, you're way more likely to catch potential risks early on. It empowers nurses to be more like vigilant and proactive about keeping those safety standards high. And it just creates this learning environment where everybody benefits from sharing what they know and what they've experienced.
Okay, so open communication, that's step one. What's next on this pathway to excellence?
Step 2 is all about continuous education and training.
Yeah.
So like healthcare is always changing, right?
Right.
New procedures, new technology, new medications are coming out all the time. So it's super important for nurses and other healthcare professionals to like stay up to date on the latest safety practices.
So we're talking about more than just like the initial training you get when you start a new job.
Oh yeah, definitely. This article suggests that hospitals should be holding like regular workshops where nurses, they can practice handling those really tough situations, refresh their safety knowledge, and even learn from like simulated scenarios. And they also emphasize how important simulation training is. That's where healthcare providers can practice those complex procedures and emergency situations, but in a safe, controlled environment.
It's like a flight simulator, but for healthcare,
Yeah,
right?
exactly.
So they can like make mistakes and learn from them, but without putting actual patients at risk.
Yeah, exactly. It's incredibly valuable. And these kinds of training programs, they help reduce errors, they keep safety practices like fresh in everybody's minds, and they boost staff confidence, in their ability to handle those tricky situations, but safely.
Okay, so we got 2 down, 3 to go. What's step number 3?
All right, so step 3 is all about designing workflows and policies that prioritize safety from the very beginning. It's like making safety a natural part of everything you do, not something you just tack on at the end.
So not just like, having that policy manual that sits on a shelf and nobody ever looks at.
Exactly, yeah.
Yeah.
It's about actually using those policies in a way that makes sense for everybody. So imagine like having clear, simple safety protocols that are baked into every single aspect of care, from like giving medication to using equipment, having enough staff, making sure workloads are balanced so nurses aren't stretched too thin and more likely to make mistakes. It's about creating an environment where safety is literally built into the way things work.
Okay, I like it. So far, we've got open communication, continuous education, and safety-first workflows. What's step number 4 on this pathway to excellence?
Okay, step 4 tackles a really important but often overlooked part of safety, and that's psychological safety and staff well-being. So this article is reminding us that safety isn't just about like physical safety, it's about mental and emotional health too.
Yeah, we talked about burnout earlier, and I can totally see how that's connected. Like, if you're constantly stressed and you don't feel supported, it's going to be way harder to, like, stay focused and be vigilant about safety.
Exactly. When nurses and other healthcare professionals, when they feel emotionally safe and supported, they're less likely to experience burnout, and they're more likely to be engaged in their work. And that translates to safer care for patients.
Okay, so how do you actually create that kind of supportive environment? Like, what does that look like?
Well, it starts with leadership. Leaders have to set the tone. They got to make it clear that it's okay to struggle, it's okay to ask for help, and it's important to prioritize self-care. This article, it suggests things like regular check-ins with staff, creating like peer support groups, and giving people easy access to mental health resources.
So it's about creating a culture where people feel comfortable saying, hey, I'm struggling, instead of trying to, just tough it out on their own.
Yeah, exactly. It's about recognizing that we're all human, we all have limits, and sometimes we need help. And when that support is there, everybody benefits.
All right, we've got 4 steps down: open communication, continuous education, those safety-first workflows, and prioritizing psychological safety and staff well-being. What's that final step, that 5th step on this pathway to excellence?
Step 5 is all about celebrating successes. So the article, it really emphasizes how important it is to recognize and reward staff for their efforts to put safety first. It's a powerful way to reinforce that message that safety matters, to boost morale, and to create that like positive feedback loop that encourages everybody to keep striving for excellence.
So how do we like actually celebrate these safety successes? Like, how do we make it feel genuine and, have an impact?
It doesn't have to be anything fancy. It could be something as simple as like publicly acknowledging a team that implemented a new safety protocol really well, or sharing stories about how a nurse, they were thinking quickly and they prevented a potential accident, maybe creating safety champion awards, or highlighting safety successes in staff meetings.
It's like, making people feel valued and appreciated for making things safer for everyone.
Exactly. And those good vibes, they can be contagious. It can inspire other people to step up and make safety a priority in their own work.
As we're talking about these 5 steps, I'm realizing it's not just about healthcare professionals, taking action. I think we all have a role to play in making healthcare safer.
That's a really great point, and it's something we're actually going to dig into a little bit more as we continue this deep dive. But before we get into that, let's take a second to think about what we've learned so far about these 5 key steps to building that safety-first culture. So we've been, really getting into these 5 steps to building a safety-first culture in healthcare.
Yeah.
And it's clear that, like, healthcare professionals, they're the ones, on the front lines of all this.
Yeah, they're the ones like putting those safety protocols into action, making sure everyone's communicating and fostering that culture of like always learning.
Right. But here's the thing. Safety, it's not just a one-way street. It's got to be a partnership.
So you're saying patients have a role to play too. It's not just, showing up at the hospital and like passively getting care.
Exactly. We can't just assume that, healthcare providers are going to catch every little thing or like and anticipate every single need. We all have a responsibility to be active in keeping ourselves safe and, our loved ones too.
Okay, I'm listening. Give me some like real world examples. What can we as patients do to make healthcare safer?
Well, think back to that first step we talked about, open communication. That applies to patients just as much as it does to, doctors and nurses. We have to be clear about our symptoms, our medical history, any medications we're taking, even like over-the-counter stuff and any allergies.
That makes sense. Doctors and nurses, they're not like mind readers. They need the right information to make the best decisions about our care.
Exactly. And sometimes, important details, they just slip our minds, especially if we're not feeling well or, if we're anxious about a doctor's appointment. It's so important to like advocate for ourselves and make sure we're being heard.
So speak up. Be your own best advocate.
Got it. What about when we're in the hospital? When things can feel a little overwhelming, is there anything we can do to stay safe in that kind of setting? Absolutely. Remember that second step, continuous education. Well, as patients, we can do our homework too. We can research our conditions, learn about potential complications, and ask questions about our treatment plans, like really informed questions.
So it's about being like an engaged and informed patient, not just like passively receiving care, right?
Right. And don't be afraid to ask questions. If you don't understand something your doctor or nurse is telling you, or if you're unsure about a procedure or a medication, just ask.
Yeah, there's no such thing as a stupid question when it comes to our health.
Exactly. And remember, healthcare professionals are human, They make mistakes, just like all of us. If you see something that seems off or you have a gut feeling that something's not right, don't hesitate to say something.
Trust your instincts and don't be afraid to like wave that red flag if you need to.
Exactly. It's always better to be safe than sorry. Now, let's tie this back to step 3, those safety-first workflows. As patients, we can also help create a safer environment by just being mindful of our surroundings.
Okay, so what does that look like, practically speaking?
Okay, let's say you're in the hospital recovering from surgery. You're a little groggy from the meds, but you need to use the restroom. Even if you think you can get up on your own, use the call button, ask for help.
So it's about knowing our limits and not taking unnecessary risks, even if they seem small.
Right. Hospitals, they're busy places. Sometimes things can be a little chaotic, and it's easy to miss potential hazards. Pay attention to the signs, follow the hospital's rules, and if you have any trouble moving around, don't hesitate to ask for assistance.
And I imagine being respectful of healthcare workers and, acknowledging how hard they work, that can go a long way too.
It really can. Kindness and appreciation, they make a huge difference in a healthcare professional's day. And it helps create a more positive and collaborative environment, and that benefits everyone. And, this connects back to step 4, psychological safety. When healthcare workers feel respected and appreciated, it lowers their stress and contributes to a more positive and supportive workplace.
It's a win-win. And it reminds us that we're all on the same team working towards that same goal, safe and effective healthcare.
Exactly. Now let's think about step 5, celebrating successes. As patients, we might not be the ones giving out awards or, making speeches, but we can definitely show our gratitude to those healthcare professionals who are really going above and beyond to keep us safe.
A simple thank you can go a long way. And sharing positive feedback with the hospital, with the administration, that can help reinforce a culture that values safety.
Exactly. Our words have power. And by acknowledging and appreciating those people who champion safety, we're contributing to a more positive and safety-conscious culture.
It's pretty amazing to think about how we can all be a part of creating a safer healthcare experience, whether we're, wearing scrubs or a hospital gown.
It really is. And as we move into the next part of our deep dive, we're going to explore some of those cutting-edge innovations and future trends that are shaping the future of patient safety.
Sounds fascinating. I'm really curious to hear what the future holds for this really crucial part of healthcare. Okay, so we've talked about like the 5 steps to a safety-first culture and how we can all be a part of that. But now I'm like really curious about the future. What's coming next for patient safety?
Well, that's where it gets really interesting. Healthcare is always changing, always evolving. And there are some really incredible innovations that are going to make healthcare even safer. Imagine a world where technology, it doesn't just treat us when we're sick, but it helps prevent those errors and complications before they even happen.
Okay, now you've got me hooked. Tell me more about this future. What kind of innovations are we talking about here?
One area that's really exploding right now is artificial intelligence, AI. We're already seeing AI being used in healthcare to analyze tons of data, identify those potential safety risks, and even predict adverse events before they occur. It's like having a digital guardian angel watching over patients.
Ooh, a digital guardian angel. I like that. So how does that work? Like, what's a real-world example?
Well, think about sepsis. It's a really serious condition, can be life-threatening, and it can be hard to spot in those early stages.
Mm.
But AI algorithms can analyze electronic health records, lab results, even vital signs, all in real time. And they can flag patients who might be developing sepsis. That allows doctors to intervene earlier and potentially save lives.
Wow, that's pretty amazing. Early detection is so important for so many things in medicine. Are there other ways that AI is being used to improve patient safety?
Oh, absolutely. AI is also being used to improve medication safety. There are systems that use machine learning to like cross-reference patients' medications, allergies, their medical history, and they can flag potential drug interactions or dosage errors. That's really important for patients who are on multiple medications because the risk of, having a bad reaction that's much higher.
So like having this extra layer of protection, right?
Yeah.
Like a safety net that catches those problems before they become really serious. So what else is out there? What's on the cutting edge of safety in healthcare?
Another area that's showing a lot of promise is simulation training. We talked about it a little earlier, but it's worth highlighting because these simulations, they're getting super sophisticated, really realistic. They let healthcare providers practice those complex procedures and emergency situations in a safe, controlled environment, kind of like a pilot training in a flight simulator.
Makes sense. You can like really hone your skills and learn from those mistakes without putting a real patient at risk.
Exactly. And the great thing about simulations is that you can do team training, doctors, nurses, pharmacists, everybody working together seamlessly, which is so important when things get stressful. And as virtual reality and augmented reality get even better, those simulations are going to become even more immersive, even more effective.
I can see a future where every healthcare professional goes through like really intense simulation training before they ever set foot in a real hospital.
Yeah, I think we're heading in that direction. And it's not just about those technical skills. It's about communication, teamwork, and being able to handle the pressure.
And speaking of communication, what kind of innovations are happening in that area? I mean, we know clear communication is so important in healthcare, but it can be tough in a busy hospital.
Yeah, for sure. Miscommunication can have really serious consequences. But there's some good news here. There are all these new communication tools and platforms being developed just for healthcare. Think like secure messaging apps that let doctors, nurses, pharmacists, everybody communicate instantly, no matter where they are in the hospital.
So no more like playing phone tag or relying on handwritten notes that could, easily get lost.
Exactly. These platforms, they make communication so much smoother, they reduce the risk of errors, and they make sure everyone has the most up-to-date information about the patient. It's a game changer for safety.
This is all so exciting. We've talked about AI, simulations, those communication tools. What else is out there? What else is happening in the world of patient safety?
One trend that's particularly interesting is this growing focus on human factors engineering. It's a field that's been around for a while in other industries, but it's starting to be applied to healthcare in a big way.
Human factors engineering. I'm not familiar with that. Can you explain it?
Sure. Basically, it's the science of designing systems and environments that are safe, efficient, and easy for humans to use. So in healthcare, this means thinking about how people interact with medical devices, how information is presented on computer screens, even how the physical layout of a hospital can impact safety.
So it's like anticipating where people might make mistakes and then designing things to minimize those risks.
Exactly. For example, human factors engineers might redesign a syringe or an IV pump to make it harder to use it the wrong way. Or they might develop standardized protocols and checklists for complicated procedures so it's less likely that somebody will miss a step. It's a very practical approach to improving safety, and it has the potential to make a huge difference.
This has been like such an eye-opening conversation. It's really inspiring to see how innovation is changing patient safety for the better. AI systems, high-tech simulations, and even this, like human factors engineering, the future of healthcare, it's pretty amazing.
And I think the most important thing to remember is that all of these innovations, they're really about people. It's about supporting our healthcare providers, giving them the tools they need to do their best work, and creating a system where patients feel safe, heard, and respected.
Well said. A safer healthcare system is a win for everybody, and it's definitely something worth striving for, innovating for, and speaking up for.
Absolutely. And I hope this deep dive has given you a better understanding of just how complex patient safety really is,
Yeah.
and all the amazing work that's being done to make healthcare safer for everyone.
It definitely has. And for all of you listening out there, remember, you have a role to play too. Be informed, be engaged, and be your own advocate for your health and safety. Until next time, keep asking those questions, keep learning, and keep diving deep.